Welcome everyone. This is Colleen McCarthy O'Toole from Cure SMA's Family Support Department. We're so glad to have you join us today for the Physical Therapy Webinar Series presentation. Thank you so much to our presenting sponsor, Biogen, for generously sponsoring the series. We appreciate all the questions that we received in advance of today's webinar and are going to try to answer as many of these during today's presentation and Q&A. You're also able to submit questions throughout the webinar using the questions box, which you find located in the GoToWebinar toolbar. Please note all lines do remain muted during this presentation. If you have any questions after the presentation, please contact the Cure SMA Family Support Team at familysupport@curesma.org. We would now like to welcome our wonderful speakers, Leslie Nelson and Tina DeWong, who will be sharing their interactive presentation, Exercises at Home for the Non-Sitter. Leslie and Tina?
Thanks, appreciate it. We'll let Tina start sharing and then we'll get started. Sure. Welcome to everyone. We're really glad that you're here. And Tina and I are excited to talk a little bit. Please, when we're done or as you go, we'll be able to field some questions, but I hope that we'll answer a lot of your questions as we go through. So we're talking about exercise, and I think that this is a really great quote from Dr. Robert Butler, who was the founder of the National Institute on Aging, and it really rings true to me, and I would assume it probably rings true to a lot of you, that if exercise could be packaged into a pill, it would be the single most widely prescribed and beneficial medication in the nation, and it really is true. And when we think about exercise, I think Tina and I have thought a lot about this, in that exercise really is a prescription in a sense, because we have to dose it correctly and kind of modify it and monitor it over time. Next slide. So when we think about exercise and really there's the benefits of exercise and fitness in itself, if we know that children are fit and have good health early in their life, that really is a marker for future adult health. If you kind of follow that trajectory, and so therefore, if you stay more sedentary earlier in life or become more sedentary, those lifestyle choices kind of lead to the increased risk for other disease, comorbidities such as diabetes, heart disease, pain, obesity, and cancer as well. And so you're kind of adding to the risk there. No, you're good. Go ahead. Thanks. So our hope would be that we give you a little bit of education on guidelines to exercise and options to help support a more active lifestyle. And it's also feasible for those of you that are individuals with SMA who do not have the ability to sit unsupported. The other thing that we have to take into consideration is the fact that we're working in a completely new era with disease-modifying therapies that are available now. And so with those new therapeutics, it may very well be that before we didn't have the hope or the thought that patients could actually improve or even acquire new milestones. But now that there's that potential there with the new drugs, and to be honest, we really need more data to really understand what the effects of exercise is going to be on our patients that are taking disease-modifying therapies. And then the other thing that we have to keep in mind is that not all of you are able to take those disease-modifying therapies. And so therefore, we need to remember that it's critical to promote function and manage any possible decline that may occur. Okay. So I mentioned that exercise really is a prescription, and that you really probably would it'd be beneficial for you to speak with your local healthcare professionals before you start any type of exercise program, especially any considerations if there's any exercise intolerance concerns, following up with a cardiologist. When we think about exercise, we highly encourage that it encompass all of the three following, including flexibility, endurance, and strength. And so we're going to talk a little bit about what that means. You do want to avoid fatigue. You all know that as individuals with SMA, it's common to have decreased endurance and fatigue, as later in the day and after activity, and so we want to try to avoid that as much as possible. And overworking muscles as well. If we do too much to stress a muscle, it can result in some what we would call overwork weakness. We'll talk about exercise in moderation and how it really should be personalized with consideration of your exercise history as well as your goals, and then how you might potentially motivate yourself, and what supervision and monitoring really needs to happen. It's not a static prescription. What I would tell you to do today from an exercise standpoint, if you're following the plan, should continue to change, and so we need to update it as you adjust and kind of react to the exercise that we've prescribed. Okay. The program that we would kind of start to talk about with an exercise prescription would be thinking about what we call the FIT principles. So the frequency, how often you exercise, how intense you exercise, and we might monitor that based upon how tired or how hard you feel like you're working with your rate of perceived exertion. Or you can use how hard your heart is working with a heart rate max calculation. How long or the time in which you should exercise, and then what are you going to focus on? What type of exercise? Is it flexibility? Is it endurance? Is it strength? Okay. We do have the published updated guidelines that were published in 2018, and in this updated version of our standard of care document, they were able to really put forth some guidelines from an exercise component. In our patients that are unable to sit, the recommendation based upon literature that we do have and expert opinion would be that stretching should be performed minimally 3 to 5 times a week. And realize I said the word minimal. So the more the better, but minimally 3 to 5 times a week. And then if you are utilizing any type of bracing, whether it be for your ankles, you have AFOs for positional support, or a TLSO for trunk support, that really, again, that minimal frequency for utilizing those braces would be 5 times a week. Okay. From an intervention standpoint, how do we start to implement exercise? You really have to start with what your goals would be. And in general, if Tina and I think about kind of what our rehab goals would be for our patients with SMA, would be that we want to optimize your function. What are you capable of, and how do we make the most of that? And then minimize impairments. Impairments are things like decreased strength or decreased range of motion. So those are going to be present, but how do we minimize the impact that those impairments have on your function, really? And then helping to optimize any tolerance to various positions, especially if you're unable to get into a sitting position unsupported. Can you do some sideline or prone types of positioning and work on those as a goal as well. We'll talk about how you can encompass trunk and head stabilization, work with minimizing the effects of gravity. So still working on strengthening, but not having to lift your arm against gravity. So you can work those muscles in a way where you don't have to fight gravity, basically. And then I think you probably are all aware that aquatic therapy can be extremely beneficial. It takes the weight of your body away, and so you're able to work in a way that's kind of in an unsupported environment, but yet there's still effects such as resistance and buoyancy and all of the different kinds of things that are acting on your body that can make it really beneficial. And then from a pulmonary standpoint, not forgetting that chest physiotherapy can be beneficial as well. Okay. We mentioned that some of that FIT principle, the second component of that principle is intensity. How hard should I exercise? And I think that's a really good question if that's something you have in your mind. One thing I would say is that you definitely, I think we would recommend that you stay away from kind of what we would consider vigorous exercise. And when I say vigorous, if you think about a scale which over to the right, we have kind of an example of, for children, this top scale is a 0 to 10 scale. They're 0, not tired at all. They could continue the activity without any thought. 10, they're very, very tired. You really cannot do anything further. And then the same thing in an adult perspective, there's kind of a numbered scale where you kind of think through how hard am I exercising? And if you're above a 7, that would really be considered more of a vigorous exercise. The other way you could calculate that is actually use your heart rate in which at the moment in which you're working, and then calculate that with the formula, and if your heart rate max was ranging between 77 to 93%, you'd want to probably back off a bit. So recommendations would be light to moderate exercise, and usually a 6 or low. And I love this slide that Tina put in that one of our best ways to describe, no, go ahead, Tina, you're good. One of your best ways to describe how to monitor that 6 and below is really kind of a talk test. Can you still talk to someone if you were exercising and had someone next to you? But really, if you thought about trying to actually sing or put forth a little bit more effort with that, it'd be difficult for you to do while you were exercising. If you're about that intensity, I think that you're probably right about where you need to be. And then again, thinking about your, how tired do you feel that you are? And looking again at remembering that scale on a 0 to 10 scale would be kind of a 6 or below. Okay. So we already talked about the fact that really your exercise program should think and consider different types of endurance or cardiovascular training, which when we think about that, we're going to use lower resistance and higher repetitions. And then if we think about strength training, we're really working the muscle with a higher resistance and but lower repetitions. And then I think it's really important that we not forget the concept of flexibility and stretching and how that has to play into your exercise program. If you don't have the length of a muscle to work, there's no way to strengthen it. So you really have to kind of work on that. Endurance and cardiovascular exercise, aquatics again is a really nice option to aerobically work from a standpoint of exercise. And then not forgetting that we have things that could help us from an assistive technology standpoint or different orthotics or braces. So if you're unable to sit unsupported, but you're able to sit with the assistance of a TLSO, that gives you a little bit more support, then use that and then work on dynamic movements while you're supported out, within your brace. Same kind of thing, maybe you're in a standing frame of some sort and need AFOs of some sort to give a little bit more stability at the ankle. All of those things can help with stabilization. And we're going to talk today about how you can also work on your core or your proximal stabilization, which really means those muscles closer to your trunk, and work on how you can improve your endurance in those muscles. Okay. Now we're going to move to what we would call strengthening exercise. Remember, that was higher resistance, lower repetition. And one thing that we will, as we go through some of these videos, is talk about what the difference is between an isometric contraction versus concentric versus eccentric. So our muscles can work in different ways. When we really, the easiest way I can think to kind of describe it to you is an isometric exercise is when really nothing moves. So if I push against my hand, I'm working the muscles that are doing the action, but I'm not having to work against gravity. I'm not having to shorten or lengthen the muscle to contract. That contraction's happening without any movement. Versus concentric, that when you're doing that action, that muscle is actually shortening when you're working the muscle in that shortening manner. And then eccentric is when you're doing an action and the muscle's lengthening to control the movement. And what I'll tell you is that there's a kind of a graded variation in how the difficulty of those can be applied. And we'll talk a little bit about that with videos. Stabilization is important when you're talking about strengthening. If you are compensating in lots of different ways, you're not working the right muscle. And so if you need to stabilize, so whether that be with a brace or with someone else's help or in your positioning, doing that so that you're ensuring you're working the muscle you're targeting and wanting to work. And then I also think that we would be doing a disservice if we didn't mention the potential use of adapted sports programs. There was a great article that was published that looked at individuals that participated in wheelchair soccer, and they actually measured the amount of work that was being done and showed that it really was impacting those individuals. Even though they were driving in their chair, there was still a lot of exercise going on. Okay. You know, this slide was developed a little bit with kids in mind, but I think it applies to adults as well. Playing is exercising. If you're not having fun, you're not going to do it. It's not going to be exciting to you, or it's going to be oh, I have to go do that. And there are days that happens. We get that. I get that, definitely. But if you find something that you really enjoy doing, or you do it with someone you enjoy being with, anything that you can find that's motivational is great. So whether you're an adult or a kid, play, have fun, and playing can be exercising. Sometimes exercise is as simple, and I say simple, it's not always simple, but it's as simple as just getting in a position and staying in that position for a prolonged amount of time, whether it's a minute or 5 minutes or 10 minutes. So if you need to stretch your hip flexors, you lie on your stomach, possibly prop on your elbows or use pillows to kind of position yourself, and then you watch a show or you read a book or do something to pass the time as you're lying there and stretching. For kids, or for motivation, if you're wanting them to roll or do something, you place objects of interest to them just out of their reach, so they have to work for it. And then I mentioned using wedges or pillows for propping or positioning. Various surfaces can also work. So if you think about, if you're going to work on sitting balance and you are sitting on a very firm surface, that's going to be easier than if you're sitting on an unlevel surface like a pillow or an exercise ball, something like that. So you're working harder on those unlevel surfaces. And then I've already mentioned those adaptive sports. Okay. So what should I do? That's the first thing you're asking, as far as, okay, I'm going to exercise, what should I focus on? And I think our best advice would be that what you practice really should be what's important to you. So what's the activity that you most would like to do? If you don't practice that activity, you're not going to get better at it. We could try to strengthen the muscles that do that activity all day long, but if you haven't practiced it, it's not gonna get better. And so specific training for specific goals are going to help in specific ways. And we really do know that the research even tells us that the adaptation of muscle is really based on that task-specific training. Okay. Nope. So QSMA has been awesome. Tina and I had I lost my word. We were honored to get to do a talk, I don't know, maybe a month or two ago, in which we, were able to use exercise bands that were sent out by QSA so generously. And so if you have access to those bands, you can use them in different ways. I think the biggest thing we want to highlight about the use of bands is that there are different colors. And while they're very pretty, they're really meant to be kind of the level of resistance. It cues you into how hard it will be to use that band. So the lightest resistance is going to be your yellow band. The hardest resistance is going to be your green band. You can also adjust if the light yellow band is still too difficult for you, give it a little bit of slack and work within a range that is not as tight. There's not as much tension. And so you can adjust your tension to help with resistance. Okay. And then if you signed up for this talk, you were given equipment. I think that you guys have the small inflatable ball. And Tina has some really great videos that'll actually demonstrate some different things that you can do with that. The large yoga ball, Swiss ball sometimes as they're called, can be great for different positional training, endurance training for the trunk and for different things. And then there are overhead pulleys that sometimes can be really beneficial for upper extremity activities as well. Okay.
Great.
All right, this is where you get to take.
I think it's great. Okay, hop in whenever you feel like, Leslie. I think Leslie gave us a really terrific foundation for us to have some discussion. We put a whole bunch of slides in for the sake of maybe needing it for examples and things. But one of the primary things that we get questions about is about posture and breathing in regards to people who are not able to sit. So one of the goals that Leslie mentioned earlier for people who are not able to sit independently is kind of being able to tolerate upright postures. And this really has to do with postural control. And that has to do with our muscles, our skeleton, and kind of the nerves and muscles and how they interact, but particularly how that impacts your cardiopulmonary system. So in the next couple of slides, I always talk about this soda pop model. I learned this ages ago in PT school, and it just made sense to me. So we talk about the soda pop model, basically looking at the diaphragm as the respiratory muscle, and it is kind of our pressure regulator. So we describe it as, so you can see here that in this model of I'm going to call it Coke. I'm from Oklahoma. So this Coke bottle, it really starts from the vocal folds, meaning from your mouth and where you speak all the way down to your pelvic floor. So when we talk about trunk stabilization, we're really talking about how do you create that pressure that's from your mouth all the way down to your pelvic floor, right? So your buttocks, to create this pressure so that you have a good foundation to move your arms and legs, but also to breathe and to talk, right? And this comes from supporting the thoracic system, and it all works together. So the frame of it is the spine and the ribs. So that's like the outside of the can, right? The diaphragm is what's going to regulate the pressure in the can. And then the thoracic cavity is the intercostal muscles that are the muscles between your ribs. And then you have your abdomen. And there's, the abdominal cavity is not just your abs, right? But it's your back stabilizing all of that to kind of build that pressure. So it's your abs, your back working together in order to create this kind of pressure. And what we say is, if you have weakness at any of these points that I just mentioned, you basically have a can that's open. If you have a full can, it's really hard to smash that full can, right? So things don't collapse as much. But if you have an open can, then it's more likely that you'll have more difficulty with trunk stabilization, leading to increased risk of developing scoliosis, much more difficulty moving your arms and your legs. And this is the reason why we talk about this, because it's kind of the foundation for exercising, regardless of your baseline functional status. So with talking about people who are not able to sit by themselves, one of the primary things is breathing, right? And there's different patterns of breathing support, and we just kind of want to point out some of the breathing that we see in neuromuscular. One of them is paradoxical breathing, and that comes from weak abdominals or a weak diaphragm. So you're kind of using just your accessory muscles to be able to breathe. Okay. The other one is accessory breathing. So again, it does come from weak intercostals and a weak diaphragm. So you're not really getting the abdomen functioning. So you have more breathing from kind of like the top of your body. And then, the asymmetrical breathing, because of the decreased trunk stabilization, also can put you at increased risk for scoliosis. And some of the things that kind of help with this is is playing with gravity. So we'll talk a lot about how you can play with gravity to your advantage and how it could be at your disadvantage, but also how you can use gravity to progress your exercise program, because now gravity can either be an assist or resistance. Okay. And then in regards to breathing, gravity, that's why we talk about in the standards of care, one of the goals are to just tolerate more upright positions, because when you're more upright, gravity is really putting a lot of pressure on your diaphragm to breathe. Okay. But before we do that, we get some questions sometimes about stretching. So this video, I'll just talk through it. You don't have to hear me talking, but I just wanted to at least show what you can do with the ball that was sent to you. You could use the ball as great positioning because it kind of opens things up. Just like in yoga, they always tell you to open up your chest so you can breathe better. Here, if you have your caregiver, you can have your caregivers put their hands on their chest. Okay, and then they're just going to open up your chest. And what I kind of like, if any of you know me, I don't sit still very well. So you can rock them back and forth, and that kind of relaxes the body a little bit more, and open up that chest. Okay, and then as they're on the ball like this, it kind of gives them nice extension, because we all are in that flexed position way too much, because gravity impacts all of us. Next, I want to talk about stretching the knee flexors, and you do that by bending the knee, okay? And then once you bend the knee, you're going to straighten the leg out, all right? I think right now I'm actually showing how to stretch the hip flexors, but here you go. Now that's going to be stretching the knee flexors, okay? So you're going to stretch that up to the point of where you feel tightness, okay? It shouldn't be an overpressure. It should be just to the point of tightness. You just breathe into it, okay? And the last few are, we're going to talk about the hip flexors. I'm not sure if you can actually see my pointer, but what I find helpful here is to have the opposite leg resting on the chest, okay? And then you're really stretching this point where it's from the back of your back all the way to the front of your hips, and your hand as the caregiver is going to push straight down. Get that nice at the hips. All right.
Tina, I just want to say something real quick about the chest stretching. If the ball is too much, or you feel like, or you know, as far as being able to tolerate that position, from a standpoint of chest stretching, you could even lay on your bed with a towel rolled up along your spine. And then that also gives you the capability of trying to open up that chest a little bit. So just wanted to throw that in there.
Yeah, no, that's great advice as well. Next, we'll talk about stabilization, and we talk about the theory of stabilization. So now we're going to talk about stabilization of the trunk, head, and hips. So the isometric part that Leslie talked about earlier. We're going to start. The deck kind of goes from easier to harder. So I'll just kind of run through some of this. Someone taught me this, I think in a Pilates class, and I really like it, because I'll just play it and talk through it. What we're really wanting to do for supine trunk stabilization, most of us don't know how to do this. Hand underneath the patient, and then so they can feel what they're trying to do. And I say, smush my hand down. And this ball moves up and down. You can use a smaller or a bigger ball, but what you really want is that you make a triangle, and if the ball goes up towards your belly button, that's not what you're trying to do. You're trying to push it down towards your fingers, right? And so that's kind of a good cue for someone who's never done that. It's more of like a pelvic tilt. So it's a good cue that we thought we'd share with you guys. And you can also do this not only in supine, but you can do it in sitting. And it's the same concept of sitting up tall and really pushing that back kind of into more of a flat pattern. And I just wanted to show you here that you can progress this, because the whole idea is that everyone has a different baseline to start. So if you're getting to the point where you're able to sit, you want to be able to sit by yourself. And then as you get stronger, see if you can add your arms to it, right? And so this slide just kind of shows that there's ability to progress from the supine trunk stabilization to the upright. And this little video shows, this is the normal position where we all sit in this flexed position, but we're really trying to get to that upright posture where it feels like somebody's pulling you up by the top of your hair, right? Okay. And then the other stabilization we want to talk about are pelvic tilts. And you could use the ball that was provided by QSMA. And what you could do here is stick the ball between your legs. And with stabilization, remember your joints aren't moving. So you're squeezing your thighs together, right? One of the things you want to make sure is that when you're squeezing it together, you're not hiking on one side versus the other. Right here, what I'm doing is I'm showing with my hands how to do a pelvic tilt. Okay, and that is really, really hard. A lot of people don't move their pelvis, right? So it's tilting your pelvis up towards the sky, right? So your back's going down towards the mat and your pelvis is going up towards the sky. The ball kind of helps you add in that stabilization factor so that you're really squeezing it all at the same time. And all of this plays into that Coke bottle concept where you're really getting the pressure from your pelvis, and that's going to stir everything coming up towards the head. Okay. And now, of course, we talk about the head. We talk about stabilization at the neck. And the stabilization at the neck, you kind of do a chin tuck. The reason why we talk about chin tucks is that whenever we see generally it's a lot of stacking from patients, and so they stack their head, which is great compensation. You don't have to use your muscles to hold it up, and that's good functionally. But if you want to exercise it, you want to have those muscles actually working. So if you tuck your chin, you know that you're actually working your neck flexors. As you get really good at holding it there, you can start to rotate your head back and forth, and that's kind of a nice way to progress it. One of the people I know also do this training by putting a headlamp on their head and kind of playing target practice, which is like Leslie was saying, if you make it fun, it doesn't feel like exercise. So okay. The next few slides we'll run through, and we'll talk about strengthening. Okay, using some of the equipment that Leslie mentioned earlier, as well as caregiver help. This is really to spark ideas for you as you're helping yourself, or if you're a caregiver helping your loved one. Some of the things that may be helpful that Leslie put this nice slide together is when you don't have the strength to go against gravity, things like slings and springs are helpful because it takes gravity away, and it allows you to move throughout your entire range of motion without gravity impacting that. And so that's why when Leslie talked about gravity eliminated positions, is because when you're strengthening, you don't only want to strengthen what's strong. You want to also be able to strengthen the range of motion that's weaker. And so the use of equipment is going to be really, really important for you to get there. Okay. And this is just an example of something that you can go to Lowe's or a hardware store, and if you're handy, build it yourself. I'm not sure I can, but I'm sure maybe someone in your life can build this out of PVC pipe. And then, of course, the equipment that QSMA provided is really helpful in that way. And one of these things you can use, just adapting it to different things that you have at the house. With this would be this pulley system. It's an over door pulley system, but you don't only have to put it over the door. You can hang it over anything that allows you to kind of use it like a TRX system and take away gravity. So we'll first start with some slides, this video looking at neck flexion and extension. I'm not even sure if I won't play the sound. I'll just talk through it. But this is really active head control for neck flexion. Again, here what I'm explaining is to get really active head and neck flexion. You want to tuck that chin. The progression that you can have here is that if you don't have the strength to do it upright, like the earlier video, you can have the patient a little bit more upright, so it's a little bit easier. Again, this is using gravity to kind of assist the neck flexion piece of it. Okay. And then the same goes for prone. You can start in the prone position. This is the harder position. Okay. You're going to have the patient look up. All right. And then if you want to make it harder, you can roll the ball forward, and then gravity is impacting the resistance more. And again, making it easier, go vertical. Okay. And then you have the option beyond just neck flexion extension, but working on head rotation. again, we're entirely using gravity to our advantage here. See that I'm rolling the ball to the side. Gravity is kind of helping assist that head turning, but then the patients can also do that. But as they get stronger, you can also add the arms. So there's so much you can do with the ball that really doesn't put as much strain on you as the caregiver or the person who's helping with exercise, right? So that's something that I wanted to highlight there. And then in the last of the video on the left, it also shows the use of the small ball. And here you could use the ball to get some weight bearing through the legs. Okay, as long as you could tolerate being down there, you have the arms and the knees on the ground and work on trunk stabilization with some support from the ball so that you're not holding yourself up entirely. So those are some ideas that you could have with some of the items that you were provided from this talk. We have other questions asking about shoulder strengthening, and the easier one is just side lying, right? And then you're just showing the patient where to pinch their shoulder blades together, and you're using your hands to stimulate that the muscles to move, right? So kind of waking up those muscles to do that, right? Here, I'm asking her to push her shoulder down and pinch her shoulder blades, because that creates stability at the shoulder. And you can progress that with using the ball that QRSMA provided, where you push down and then pushing forward. So you could see how this progression could work, all right? And then here is a little bit harder way of working the shoulder blades, but still not having the limbs inhibit your ability to be able to do that by using either the TheraBands you have or the overhead pulley system, right? And as you get harder, we won't talk about this, but we just wanted to at least show you the ability to use the bands to make it harder. So this young lady is pulling it apart, see, and pinching her shoulder blades together, okay? Whoops. And then this lady, she's doing rows, right? And so even adds more resistance. And so it gives you a breadth of intensities that you could try with all the at-home equipment you have. And then, of course, we can't talk about shoulders without shoulder rotation. And you could use this in both ways as well, with a resistance band to help. Like here, I'm helping her assist it out for her full range, and she's pulling it back in. Remember, with SMA, you have different muscles that are stronger versus weaker. So you don't only want to work the strong muscle. Don't be that guy at the gym, okay? You want to also work the weaker muscles, because that will help better with functioning. And as Leslie mentioned, specificity of training. Train what you want to do, right? Okay, we already mentioned that, so I will go ahead and skip that. Moving on to trunk control. The videos, a lot of them go from easier to harder. So the first thing here on this ball, you could just have the patient shift the weight. First, you're doing what I talked about with the Coke bottle, right? Once you get that nice stability, you can use the ball to change that center of gravity a little bit, and make sure that while you're doing it, you're activating those muscles the entire time. It's a lot of mental exercise as well as muscle exercise to do this, especially if you're not used to using those postural muscles. You have to think very hard to use them together, okay? Make sure that if you're the caregiver you're helping, that you have the amount of supports that's needed, particularly at the head, so that the patient can concentrate on the trunk. As they get better with that, we talk about going from isometric, right, to concentric. So this is really concentric motion. You're using the ball to help with the upper extremities, but now you're moving it concentrically and then controlling it going back eccentrically for trunk back to trunk extension, okay? And you can do this with the small ball. You could do it with the big ball. The big ball's nice if you're an adult size, and it kind of stretches out the upper thorax region where we all are a little bit too flexed. Okay. And then as we talk about specificity of training, this is a video that Leslie is showing that you can use some of these things to work on exactly what your goals are. If your goals are to roll better, let's work on strengthening your trunk's ability to roll. And so here Leslie's using the band to provide some resistance as she's rolling so she can strengthen those muscles, okay? Lastly, for trunk control, we talk about line up, and the ball is a great way to do that because again, you're using gravity. You're using gravity to assist in the areas of that movement that you need assistance, and then you're using the curvature of the ball to activate. So here, for sitting up, you have to push through that shoulder, right? And then you have to use that trunk to get yourself up. And so here, if you roll the ball down towards their feet, you can kind of get gravity to help a little bit, and that helps the muscle work synergistically together. And sometimes that's difficult when you're not used to doing that. And so make sure that, you know, something like this ball can be very helpful in that way. Whoops, going backwards. Okay. Then we're going to go and end with talking about the limbs, okay? And like we talked about the upper extremities, the easier thing you can use is to use these kind of like taking away gravity. And you can attach this pulley system to something at your house, or you can hold it, it's up to you, and just work on different muscle groups. If you're, you know, reaching, rolling, whatever that may be, even gripping with the tool, the exercise equipment that was provided. And if you're stronger, you can add the resistance band to this movement, right? And so that you have a wide breadth, just having these slings, springs, and resistance bands to exercise in the comfort of your home. And of course, if you're strong enough, you can also add this into sitting. I want to make sure we have enough time for questions, so I won't show these videos. But similar to what you saw earlier, you can work on your shoulder, your arm strength by using the resistance bands. With the lower extremities, same concept, gravity eliminated right here, working on some knee flexion, hip flexion, and extension, and throughout the entire range. You can kind of use this as a way to assist through the entire range of motion, or provide resistance. And this kind of, you holding it up gives you a little bit of control or idea of how much your patient may support or resistance that's needed, okay? Okay, did I get through that? Okay, and then this last one is an exercise that you could do on the ball. So here, the ball allows that kind of nice rolling, right? And so with your patient, you can have their feet on your chest, and they can push their legs against you. And so you can kind of increase that intensity a little bit by using the ball as well. Okay. Last, we kind of talk about heel slides. So there's different things you can do with intensity of the band, right? And to working on bringing your legs up towards your knees or hips. And this is just an example of her doing it. She can use it to pull to help assist. So if you get something that's not a band, you can use your sheet or something. Then if it doesn't have give, you can have the patient assist, so they get upper limb exercise as well as assist on the lower limbs. You can do that, and then they can push out, and that gives strengthening of the hip extensors, right? Okay. I suggest that yoga has those like sticky yoga socks that has a sticky bottom. It helps to keep the resistance band on a little bit better. And if you get stronger, you can use this where Leslie is showing how you can use a resistance band to work on knee flexion, and you're pulling straight back, right? And she seems pretty strong. She could probably move on to one of the green green bands or something. You can work both knee extension and knee flexion. Okay, and that's the same thing with hip adduction, and this is just going to be a video of showing how they can bring it in and out. And then the video on the right is harder, where now you're adding the resistance band to it. So now you kind of get the idea of how to use some of this equipment. right? So here, gravity eliminated, and the baby, his name is Tayshawn, is going to bring his legs in and bring his legs out, but that's with these the pulley help taking away gravity. Well, this young lady's a little bit different. She's going to bring it out, okay, and she's stronger with her with the muscles bringing her legs in. So the resistance band gives her a little bit of resistance to bring it in. She has a hard time bringing it out, so I'm not providing that resistance going out, okay? And of course, all of this stuff that you have, you can work with your local physical therapist to develop a program. Bring all of your exercise equipment and say, can you help me work on a program? Film some of this, take videos, and then they can help you progress this, okay? If you're sitting, you can use that ball, squeeze it together, get some pelvic, adduction exercises as well. And then you can also use the band to bring your legs apart. And so you could do this in supine and sitting. There's a lot of options you have with these things. But I just wanted to give some inspiration. Just because you're not able to sit independently doesn't mean you can't bicycle, right? And so these are really, really cool options from one of my favorite kiddos. They have him all supported, but he's able to bicycle in sitting, in supine. I don't even know how he does this thing here. He has to be super, super duper strong, but they're just be creative, think outside the box, to do some of these exercises. And I always say, if there's a will, there's a way. So talk to your physical therapist. We can be pretty creative. Okay. We'll end with some goal setting and staying consistent. One of the things is, just as Leslie said, do what you like, because the more important thing is not to be a weekend warrior, but to do it consistently. So 5-10 minutes is 5-6 days a week is much better than 2 times a week with an all-out effort, because then you may have increased fatigue or overwork. So make sure that you give yourself a break and start with small bits. Also having achievable goals, make it realistic and towards what you want to do. Talk to whoever is helping you with it so they can develop something that is meaningful to you. And I don't know, depending on your personality, you may have different ways to track or goals for yourself, and incentives. It doesn't matter if you have SMA or you don't have SMA. We all need motivation to exercise. So motivate yourself. And give yourself incentives. I'm a big tracker of my exercise to keep myself accountable. That works for me. It may not work for you, but if you are a tracker, you may want to use something like this that applies the FIT principles Leslie talked about earlier. And this also helps you understand how you're progressing, and your care provider to help progress some of these exercises for you, as you can measure the intensity, how hard you're working, what types of activities and what muscle groups you're working. Some of the considerations, there's nothing really to be scared of here. Just make sure that you do consult with a healthcare professional. If your biomechanics are not right, you may have increased risk for injury, repetitive injury, doing something in a way that your joints are not aligned. So make sure that that the quality of your movement matters. Okay, and having weakness and not being able to sit up by yourself, you may have some bone fragility and fracture risk. So keep that in mind. And of course, Leslie mentioned the fatigue and overwork earlier. And this one, you can't hear the music either, I bet. But this is the Macarena. I won't sing because you don't want that to happen. But what I love about this too is that the same boy who was bicycling, his mom is a Zumba instructor. She loves to dance, so she's dancing, and she's dancing with him using these slings and springs. In the idea of doing what you love, this is that they exemplify this this thought process. And I think that's it. We have a few minutes for questions, I think. I'm not sure who I should hand this back to.
Hi, Tina. Thank you. Thank you so much, Tina and Leslie, for that incredibly great and informative presentation and all those great videos as well. So you're right, we do have a few minutes for some questions, and some questions have come in from the community, so we'll just get started right away with our Q&A portion. So our first question, Tina and Leslie, is how do you address contractures in the arm and also the jaw?
I think first you have to define it, contractures. A lot of times when Leslie and I think of contractures, we think of a joint that is, for lack of a better word, stuck. You try to extend your full arm and it doesn't go as far, and that may be because your tendons are tight, your ligaments are tight, your muscles tight and shortened. So there's a difference between flexibility, which means that when you're stretching, it makes it less tight. But the research shows that stretching itself is not going to change your range of motion or your contractures. If you have tightness, stretching will help decrease that tightness. And so a lot of people can use the term kind of synonymously. If we see that you are stretching and it improves your quote unquote contractures, it probably wasn't a true contracture and you're able to stretch it out, right? Leslie mentioned before that stretching, the flexibility or the length tension of your muscles matter in how you contract your muscles. So that's going to be important. What we know is that for management of contractures, you have to keep the muscle in a lengthened position for at least 6 to 8 hours to actually make changes in the muscle physiology to actually increase the range of motion.
Yeah, I think the only thing I would add is that I wish we had the perfect answer for you to say, oh, this is how you address it and how you correct it. We don't have that, and so I think that it comes back to if there is a contracture, really a lot of what I end up kind of talking to the family about and the patient about is, let's see what we can do to minimize the continued progression of that contracture, because there is the potential that that contracture is going to get worse and worse and worse, because it's there because there's weakness. And so kind of trying to minimize that is probably another consideration. While it's not the answer to improve that jaw contracture or that arm contracture, it's just another consideration.
Yeah. Leslie, do you know of any devices or things that people have used, or probably outside of the SMA realm, right? In dentistry, where they're able to have the mouth blocks to kind of help with the jaw range of motion? Because I noticed that a lot of our adults too said that they feel like their jaw, they have more jaw range of motion, and it's probably from just not moving it, and now they have the ability to move it that's a little bit more flexible versus contracted. But
Yeah.
it's outside my area of expertise.
Yeah. Yeah, same for me. Jaw really is. I mean, I know how to assess it, but as far as kind of intervention and improving, maybe if whoever asked that question, it could be very well that maybe you have a speech language pathologist in your multidisciplinary clinic, that they might have some thoughts or answers just in relation to the jaw range of motion or contracture and function there. That's just another thought.
Yeah. I mean, maybe, and I was thinking about this too with the jaw, is that it's a good time to also make sure you see a dentist, and get proper hygiene, and that also is probably a really good person to ask about that, because what I noticed, like in our practice now, is that we measure some range of motion of the mouth and realize, wow, we need to be better about assessing kind of dental health. So that's now a plug for dental hygiene.
Yep.
Thank you both so much for taking the time to answer that question. Our next question that came in is, do you have any insight or perhaps examples on the effectiveness of different things that people can do by themselves, such as minute muscle movements, or even just focusing on an area and sending, quote, move thoughts?
I think Tina kind of touched on that a little bit when she made the comment of there's some mental exercise that occurs, not just physical exercise. And so those thoughts about movement are super important. The other thing is, she mentioned working on head rotation on that ball. The other that I would add, that when you're tilting the ball to encourage that rotation, If it's a younger child, give them some interest so that they want to look that way. So they're kind of engaging that mental aspect of what am I doing? What am I working? What should I think about? And then obviously as an adult, you can kind of make that decision that, okay, I know what I need to activate. Let me really think about what I'm activating. I'll give an example of even with someone without SMA. Let's say someone had a knee surgery. When that muscle is cut and when they go back through the healing process, we might ask that patient to do what we would call a quad set, where they're activating their quadricep muscle without moving it. It's more of an isometric control type of a thing. And it's amazing after that muscle being cut, the brain is not getting the message to the muscle to activate. And so they really have to start being very aware and thinking about engaging that muscle. So the whole concept of that mental exercise is a really important one. How do you teach it? How do you train it? I think, one of the best things is if you're having trouble engaging something, let's say you're wanting to work on your shoulder flexion. You want to work on raising your arm up. If you're having trouble engaging it and thinking about it, have someone push against you and think about that motion. And sometimes just having that resistance there to kind of think about the motion you want to do can be helpful. I don't know, Tina, what else?
Yeah, I always say, bring all your senses in. Bring in a mirror. If you could see it, you can think about it more. Also, I think in the concept of physical therapy, this is what we would put under kind of like neuromuscular education. And so when Leslie was saying, so you could feel it, you could tap on it, you could, if you know what muscles you're trying to work, you wake. I always say think about waking it up, like you're going to wake it up. I think we mentioned before using like a low intensity functional e-stim for some of our adults to do that alongside a bike, so that can remind them, okay, this is when you use your biceps, and then alongside that you have a therapist as you're cycling say, okay, now or whatever it is, whenever you're ready to use that muscle. It is really a mental sport just as much as it is a muscular sport. And we acknowledge that. That's why I think the small bits of concentrated working out is more important than the long haul, until you kind of get that fine-tuned.
Great. Thank you both so much again. So we've got time for just one additional question that came in, and it is surrounding aquatic therapy. And I do want to plug, we do have an aquatic therapist who has done a couple of different webinars too, but the question is, if my chest or a big portion of my stomach is underwater, the pressure of the water makes it hard for me to breathe. Any tips on this? They're not trach or BiPAP dependent. They just feel like they're not quite in the water and they can't do as much when they are not in the water.
I'll speak to what I know there. As far as the first thing I would say is, I do know that gradual entry into the water could be important. So if you're being lowered into the water via lift system or something such as that, really taking it as slow as possible can help as you kind of accommodate to that pressure. Just the principles of water is what's causing it being difficult for you to breathe. And so it's that water and that pressure pushing against your chest. So slowing down your entry into the water is probably the first thing. The other thing I would say to that is, if you have the capability, start in shallower water. So get used to less of your body being underwater and work what you can there, and then gradually build your way into the water. Sometimes it's anxiety. Sometimes it's not the pressure of water, it's the anxiety of, okay, I don't really know if I can control my body. I'm about to go underwater, and you kind of have that anxious feeling. And so being aware that that could be a component of it. I'm by no means someone who can tell you how to manage it. I can't manage my own anxiety. So trying to manage anxiety is another concept there. And then the only other thing I would offer there too is, and I don't know, Tina, you can correct me if I'm wrong, if the water temperature would make a big difference. If it was, I don't know
Yeah,
the
I
principles
don't
of
know,
water
but
enough.
yeah, no, I don't know, but I would say that would impact anxiety, right?
Yeah.
Too. Yeah. Yeah, no, I mean, I think your answer is absolutely perfect. And I mean, one other thing I would say is being on top of the water also gives you benefits, because the way that your trunk could move in the water is drastically different than, gravity's not your friend sometimes. It's not our friend a lot of the times.
Yeah, for sure.
Fantastic. Well, thank you so much again, Tina and Leslie, for your wonderful presentation and your time with these questions as well. Excuse me. We are so grateful again for your time, and we're so grateful for everyone who was able to join us live for today's webinar. You will be receiving a follow-up email with a survey link, and we, as always, would greatly appreciate any feedback that you have to share with us. And we're also thankful for the incredible support from our presenting sponsor, Biogen, for making the physical therapy webinar series possible. Again, if there's anything that we can do for you, or if you have any additional questions, please email us at familysupport@curesma.org. Have a great evening, everyone.
Thank you.